There are several conditions that we need to talk about briefly. We talked about long QT syndrome and Brugada syndrome, which are ion channel disorders. And these are the most commonly implicated ion channel disorders that cause sudden death in young people. But there are other rarer conditions, such as the short QT syndrome, which is again a problem with ion channels, but this is a potassium ion channel that's working over time rather than under time. This is a novel condition which we don't know much about, but it's again a familial condition that runs in families that's characterized, as its name suggests, by a short QT interval on the ECG. There's a predisposition to heart rhythm disturbances in the form of atrial fibrillation and sudden death, and the current treatment, there's only one treatment, and that is an internal cardioverter defibrillator. There are no tablets that can save lives here. We don't know how to stratify risk in this condition at this point, and we don't know what else to do with someone who's got a short QT other than put in a defibrillator. But I suspect this condition is very rare because in my 14 or 15 years that I've been working with CRY, I've only seen it once ever, and we've screened numerous people, and I've seen numerous patients in my clinics. There's another condition called catecholaminergic polymorphic ventricular tachycardia. Another condition that is genetic, inherited as an autosomal dominant trait. So if a father or mother has it, there's a 50% chance they'll pass it on to their children. It's a problem with the ryanodine 2 receptor gene, or the calsequestrin gene, and it basically makes the heart very, very sensitive to the effects of adrenaline. So unsurprisingly, most of these deaths occur during exercise when the body is producing a lot of adrenaline to allow the heart to pump hard, and they occur following drug abuse, things like cocaine and amphetamine, which make the heart very sensitive to adrenaline. The treatment for catecholaminergic polymorphic ventricular tachycardia is to give drugs that protect the heart from the effects of adrenaline, and these drugs are known as beta blockers that I've already talked about early on. So we give beta blockers. In those people who continue to have blackouts or bad rhythm disturbances with a beta blocker, we recommend implantation of an internal cardioverter defibrillator. So we've dealt with the ion channel disorders. I think it's also very important to consider coronary atherosclerosis. This is furring up of coronary arteries. One normally sees this condition in people aged above 50 or 60, those that smoke a lot, have diabetes mellitus or a high cholesterol. In rare instances, there is a condition called familial hypercholesterolemia, where the liver makes too much cholesterol and people walk around with cholesterol levels well above the norm. The norm's about 5 millimoles per litre, but some of these people have cholesterols of 18 to 20 millimoles per litre. And these people develop premature atherosclerosis, that is furring up of the coronary arteries, and can have premature heart attacks. In fact, the commonest presentation of familial hypercholesterolemia is a sudden death from a heart attack, and many of these sudden deaths occur during sport. The condition can be diagnosed by examining a patient very carefully. We can see fatty deposits around a patient's eyes, around the pupil as well. There's a white ring around the pupil, fatty lesions just around the eyes here. If we look at the hands very carefully, in the creases of the skin, we see yellow fatty deposits there as well. That sort of gives us a clue that someone's cholesterol may be high. Of course, we then measure the cholesterol, and if it's something silly like 10, 12, 13, we know that it's probably a familial condition, and there are fantastic drugs in the form of statins that you've probably all heard about, that lots of people in the country take, that bring down the cholesterol and reduce the risk of sudden death in this condition.